How often do I change the bag?
Ostomy bags or pouches should be changed anywhere between 1 and they can go as long as 4 days, depending on your child's stool output and the amount of stool that they have out. You really want to change it on a regular basis, one that works best for your family. And sometimes for infants and toddlers, it's always easy to plan that when there's two people around, someone to help entertain or hold the child and the other one to actually change the ostomy bag. But whenever you can change it on a regular schedule as part of your usual routine, once daily, maybe do it in the morning when you're doing the baby's bath or shower, or for some kids in the evening, they like to do it when they're showering before they get ready for school the next day. You just want to change it at a predictable time so that you're not waiting until the bag leaks and then you're changing it, because that's never an ideal time. It's not ideal circumstances.
How do I learn to care for the ostomy?
While you're in the hospital, most patients are in the hospital for anywhere from 5 to 7 days, and certainly depending on the child's clinical condition and other diagnoses, they may be in longer. But rest assured that while you're here in the hospital, we as a rule, change the first ostomy bag after a surgical procedure on post-op day 2. So you'll have the opportunity to look and watch. You'll be reading some information about it before that. And then post-op day 4, we have you start diving in and helping us, either removing, helping to wash the skin, do some of the steps of it. And then post-op day 6, you doing the ostomy bag change with nursing, supervising and assisting you, answering any questions you may have. So you'll have the opportunity to at least see an ostomy bag change 3 times while you're in the hospital, and to assist hopefully at least twice with that. And then at the time of discharge, we will set up a visiting nurse agency to come in so that you'll have some reinforcement of what you've learned in the hospital at home, and you'll feel a little bit more comfortable knowing that you're going to have a little bit of a guardian angel at home as well, helping guide you as you're learning this.
How do you keep an ostomy private?
For based upon your child's age and their developmental level, that's a question that families will often ask. I think that if you have an infant or a toddler, it certainly is easier to keep it private. If you change their diaper in a private area, you can empty their ostomy bag at the same time. Usually there aren't multiple people knowing. It's when kids go off to school, when they're school age or adolescents, they may be involved in sports, or that it gets to the point that we need to say to families, you really do have to let the school nurse at minimum be aware that your child has an ostomy. I have found over many years that even school age and adolescents that are very private kids, very reluctant to ever think of sharing this information with anybody because they find it embarrassing to have an ostomy, that many of those kids, their first or second post-op visit outpatient, when they come in, they walk and say, oh, I landed up, telling this one, or this kid knows it. And I think for many of those kids, they'll just say, it's not like they've lifted up their shirt and necessarily shown their entire class, although I actually have had some kids do that as well. But many of them just say, I have to wear a special dressing on my belly. I had an operation on my stomach, and I have something called a stoma. And they keep it as simple as that, and they move on. With kids changing in locker rooms and whatever, most kids are relatively private about it, but I think that I've really seen that it is more often parents that are much more concerned and uptight about it because they are trying to do what's best for their kid. They're afraid that their child may be made fun of. But I have to tell you that that's not the experience that most kids have. Many of those kids we also have named their stomas. They come up with quite funny names for their stomas. Gertie or Rosie or Patrick or SpongeBob. And sometimes for kids that's great because they can, even if they're out in public with their families, often be able to say, Mom, I think we got to check Patrick. And they can still be private in a larger group, but it's their code name. Their parents know exactly what they're talking about.
Does the ostomy smell?
Does the ostomy smell? Well, I will also start this conversation with most parents and kids with poop smells. Everybody's poop smells. And I think there's a great book that's out there for many years that people know that everybody poops. And it certainly helps open up the discussion with many of the kids. Stool or poop smells. And I say to the kids all the time, your poop smelled before you had an ostomy, and your poop is going to smell after you have an ostomy. The biggest concern that people really have is, can they smell me having poop on me when I walk into a room? The ostomy bags these days are all odor proof. It's not like what some parents even may have known if they ever knew someone 10 or 20 years ago that had an ostomy bag. Ostomy bags are odor proof. When you have an odor from your ostomy, it's when you open up the tail of your pouch, when you're sitting in the privacy of a bathroom and you're emptying the stool out of your pouch. When you open it up, then you can smell. I mean, poop smells. And that's the point you just got to keep saying over and over to kids. I do think that there is something to be said about when kids, even kids that have had diseases, that they have had frequent stooling and sat on a toilet. And I think that there is a difference when it is on their belly. I think it's closer proximity to your nose. And I think even for infants and toddlers, parents are more used to emptying poopy diapers, so they're a little less offended by the odor. As a rule, the people that struggle with it the most are probably the school-age adolescent kids, and they're just more fearful that kids are going to know that they smell. And again, as long as they keep the spout very clean, when you empty your pouch, I say to the kids, it's the inside of this spout here that they have to take toilet tissue, or a lot of kids will use wet wipes, the type that you use when you eat lobster or fish. They just want to make sure that they really clean the inside of the spout here, because if poop has splashed up or is all over the outside when you roll it up, then it is open to the world and the world could smell it. But as long as you keep the inner spout of it clean, it is highly unlikely that anybody is ever going to smell it.
Does an ostomy make noise?
Yes, sometimes your ostomy will make noise, especially post-op when everything is first starting to wake up and things are moving through from the stomach, through the bowel, and out your ostomy. Kids call this a lot of different things. Sometimes they'll say their stoma's burping, their stoma's farting, their stoma's passing gas, their stoma's having flatus. That may be family specific, the language that you want to use with your child, or that the kids just spontaneously come up with on their own. It's quite comical, some of the terms that I've heard. But in the beginning, when action first starts waking up in the GI tract, the food tube, as we call it to the kids, they will hear gurgling, bubbling, and sometimes even a and they're like, oh my goodness, is that going to slow down? Very often that will slow down once they're on solid food for about 7 to 10 days, because things tend to start slowing down a little bit more. Many times I'll say to the school age and the adolescent kids, because of course it's a bigger issue for them than it really is for the infants and the toddlers who are clueless, and that's part of their developmental stage anyway, and they think it's quite comical when they fart, or they fanny burp, or whatever they may call it. For the school age and adolescent kids, I'll oftentimes say they may be standing with a group of their friends and somebody passes gas in their group of 6 friends, and you can clearly, when somebody passes gas in a small group like that, they're all looking like, oh, who did that? And you can associate odor with the person, because whoever usually passes gas, the odor is permeating around them. In this, remember, because the bags are odor proof, it's contained within it. They may hear the sound, and very often a lot of the cloth covered ones, and you've got a layer of clothing over it as well, that does muffle it. But certainly you may be the one and you go, hey, it's just a little action from my food tube. Or some of the kids will go, hey, it wasn't me. It's not like you immediately have to fess up that it was your stoma. And if people don't know you have a stoma, then they think, wow, that was kind of a quiet fart that kid had. So it's one of those expect it. We teach kids about it, so it's not a big surprise if they're out with their friends. They also may find that certain foods stimulate them to have gas more. As a rule, with school age and adolescent kids, the types of food that give you more gas aren't usually the things we can get in them anyway. Things such as Brussels sprouts, beans, those are big ones, that can give you more flatus or gas.
What can't you eat with an ostomy?
So, again, in terms of infants and toddlers, we don't recommend any special dietary restrictions. Most primary care providers, if you have an infant or a toddler that has an ostomy, you can, unless your clinical condition and you've been told by your surgeon for other medical reasons that you can't advance to a normal diet for age, we have no restrictions. If your primary care provider tends to start cereal at 4 months or 6 months to help thicken them up, we don't restrict. When you start introducing foods, we do the same thing, that whatever it's specific to your primary care provider, if they want to start one fruit every 3 days or they want to start one vegetable, the pureed baby food type, there's no restrictions. In terms of older kids that are eating more, normal quote unquote diets, there are minimal restrictions unless you have a specific clinical condition that restricts your diet. The biggest things that I suggest to people is foods that bothered them prior to surgery, if they have inflammatory bowel disease, that they speak with their GI doctors, or they start introducing one food at a time. They don't go out if spicy foods have bothered them, or tomatoey foods, or pizza, or things with cheese have bothered them. They don't go out in one day and eat tacos and pizza and something else, that they slowly introduce foods that may have bothered them prior to surgery. The other restrictions that we have post-op are that we want things that you may not obstruct or block your food tube with. Because there's swelling in the immediate post-operative period. So the inside of the food tube or the bowel may be smaller than usual because of the swelling from the operation. So we want to, things that your parents always told you anyway, chew your food really well. We suggest that you avoid corn and popcorn for the first 6 weeks after surgery for school-age and adolescent kids, and peanuts, sunflower seeds, things that have husk that are very difficult to digest. Because most people can't just eat a few peanuts, they can't just eat one handful of popcorn, they're eating handfuls of it and it can block. Other restrictions that we may have are some of the raw vegetables, such as carrots. A lot of, teen girls right now go around, they've got bags of the mini petite carrots in their backpacks, and they're just munching those down all day long. You can't eat a bag of raw carrots. Your body just can't digest them that well. It certainly doesn't mean that you couldn't steam carrots or you can't eat some carrots, but you need to take it easy. The other foods that we suggest restricting post-op are casings around hot dogs, kielbasa, sausages. Again, if you chew your food really well, there'd be no restriction. You could eat hot dogs. But if you were going to be like some of the teenage boys that I know and eat 4 or 6 hot dogs, or 2 extra large Italian sausage subs, then you do need to be concerned, because the casings aren't easy to be digested that first few weeks. If you chew gum, you don't realize that while you're chewing gum, you're swallowing a lot of extra air. That air goes down into your stomach, follows through your bowel, and comes out in your ostomy bag, and it'll blow up like a popcorn bag. And again, that may lift the seal away from your skin and result in leakage of stool under the wafer and your bag falling off. Carbonated beverages, and that does mean soda. If you drink a lot of carbonated beverages, again, that gas, that carbonated bubbles go down, and you may also blow up your bag, and the bag may come off. And drinking with straws. All of those, because you don't realize as you're drinking with straws, you're swallowing a lot of extra air. Now, sorry parents, but it doesn't mean that they can never have soda if it is okay with their parents. Some kids, you can have some soda, but what I would suggest is the times that you do have soda, that you pour it into a glass, you stir it around with a straw, let a lot of the bubbles come out for about 10 minutes, and then you could drink it, and it's much less likely. I think most kids are so nervous that their bag's going to fill up with air that even if they were big, kids that like soda a lot prior to surgery, they almost self-limit themselves post-op because they're afraid of all the air that might come out in their bag.
How much fluid should you drink?
One thing that's important to remember is if you or your child has a lot of output from their stoma, you do need to pay attention to that because you have to make sure that you're replacing with fluid what's coming out. That might particularly be an issue during a time of increased activity for some kids when they're playing sports, or if your child is put on antibiotics for something such as an ear infection or strep throat or something else, that may tend to loosen their stool more and they may have more watery stool output. So you do have to pay more attention to their fluid intake so that they don't get dehydrated.
Can teens take care of their own ostomies?
Teens value their privacy, and just as they don't want their parents to help them in the bathroom, they really often won't want help taking care of their ostomy. Now, that may not be the case immediately post-op in the hospital. That first few days, they really don't want much to do with it. But over the course of the hospitalization, you're going to see the nurses that we really strongly encourage the teen to be the one that is the primary person that's learning how to take care of their ostomy, so that when they go home, they're usually only home for a week, maybe 10 days after surgery, and they're back in school, and we want to empower them. And also, it's a very hard habit to break. If kids go home and their parents have been the only one to do it, they then only want their parents to be changing and emptying their ostomy bag, and it will look pretty silly if you're going to school and going into the bathroom, or if they're in the mall at Papagino's and you're going into the bathroom with them. Their friends will be, if they have chosen not to share this with friends, it just isn't something that usually is done. So I think that follow their lead. If they want help, help them. You certainly will be learning ostomy care along with them in the hospitalization so that you can oversee and help supervise and be a source of support for them. But if they want to manage their own ostomy on their own, I would let them and certainly give them guidance if they feel that they're having any skin issues, or you notice that they're changing their bag more frequently than even once a day, then there's probably something going on and you need to get involved with that and ask questions. Ask them how they're doing, any skin issues, are things okay? I think you changed your bag twice today, if I'm not mistaken. What's going on? That's not how it should be. So take a little bit of a lead from them.